Springtime in Bethlehem is quieter than usual, and while people stay home, Amanda Augustine makes sure she spends some time outside. How do you feel when you're at home?
Claustrophobic at times.
Why?
Because I don't like being stuck indoors for long periods of time.
Amanda has autism. She lives by herself, but 3 days a week, Lauren Burlew stops by.
We go for walks, and she's emotionally supporting me.
Lauren has worked with Amanda for about 5 years as a behavior specialist with VIA of the Lehigh Valley.
A lot of people with autism need structure and routine, and we're trying to maintain as much of that structure and routine as possible. And a lot of people like Amanda who live by themselves are reliant upon these supports.
COVID-19 has drastically impacted life for everyone. And for those on the autism spectrum, significant change can be tough to handle. Talk to me about what you're missing right now.
My class, there's Edge class, going out in the community more often.
Lauren works with Amanda and 9 other people who depend on VIA services, but some of them can't meet in person right now.
We've been using virtual supports through Skype or like Samsung video chat, just to try to make sure that people, even if they can't be meeting with us physically, are still maintaining their routines, still have their self-care plans in place.
Because autism is a spectrum disorder, the range of symptoms is wide, and so is the severity. Some of the symptoms include challenges with communication and social skills, as well as repetitive behavior and obsession. Julie Trebat is a board-certified behavior analyst who works with kids who have autism.
Julie, can you talk about the importance of making sure that people on the spectrum have what they need right now?
So these days, of course, if you can imagine a single mom going to the grocery store, and she has to take her child with autism because she doesn't have a choice. The child may not be willing to wear a mask because she can't explain it to them because they don't have the language to understand those words. So I think that the best thing that we can say is that people can be extra kind when they see a child that's behaving in a way, or an adult that's behaving in ways they don't expect, because it may be that that person really can't understand what's happening right now.
The Centers for Disease Control and Prevention says 1 in 54 kids in America has autism spectrum disorder. The Pennsylvania Department of Human Services says it serves about 56,000 people of all ages who have intellectual disabilities or autism.
This population is particularly vulnerable to COVID-19 for a couple of reasons. One, our population has a higher prevalence of some of the co-occurring diagnoses that make someone more vulnerable to COVID-19, like hypertension and diabetes. We also serve a population that is dependent on care.
It's a new reality for parents like Erica Daniels. The Montgomery County mom has been helping her 15-year-old son, Leo, adjust to the changes.
Leo, like a lot of other children with autism, is very schedule and routine oriented. So changing his schedule has really given him more anxiety.
She says her family is handling Leo's anxiety well, but the same can't be said for everyone, especially since the autism spectrum impacts people differently.
Other families are really in dire straits and having full-blown meltdowns and self-injurious behaviors, and even having to go to the emergency room.
Let's talk about the coronavirus.
To help people with autism understand what's going on, illustrations like this social story offer some help. Sesame Street has also come up with specific tools for families to cope with COVID-19. It's a different type of education, as Pennsylvania schools will stay closed for the rest of the academic year.
We really rely on a village as autism families, and we have oftentimes, up to 10 or more professionals working with our children. So suddenly all of that has stopped.
An autism support class is kind of hard to do online. And so I think people are struggling on how can they get their kids to kind of cooperate with this new way of learning.
It's an uncertain future that's taking an emotional toll on families everywhere.
What advice do you have to parents right now who are trying to stay positive for their children?
It's hard when you have a child with autism to find the time to take care of yourself. So I think that people should try in some way, though, still to find a way to take care of themselves.
Caring for each other and thinking about those who still rely on others to get through each day.
If suddenly, these agencies are closing and we can't provide these supports, then that could be catastrophic for some of these people.
To find resources for those with autism, we'll have links with this story online at pbs39.org. In Bethlehem, Northampton County, I'm Stephen Jiwanmall, PBS 39 News Tonight.